Hello everyone, my name is Sherifat Abdusalam. Today I'll be performing tracheostomy care. I have proper attire on, my badge is visible, no jewelry, no nail polish. First thing that I've done here is to verify physician's order, and I have my supply. I'm going to be using a clean glove. I have the tracheostomy kit. I have hand sanitizer for hand hygiene. I have tape to use. I have a patient ready here with the trachea line. Normally I'll have 2 bottles filled with hydrogen peroxide and normal saline on the side. I'll just verbalize that. Once I've done that, I'm going to gather my supply. I'm going to go into the patient's room, knock, provide privacy, introduce myself to the patient. My name is Sherifat. I'm going to be your nurse today, and then I'm going to identify the patient 2 ways: with their name, date of birth, and I'll verify that with the wristband. Then I'll proceed by explaining step by step of the procedure to them, the duration, let them know to let me know along the line how well they're tolerating it, or if they're not tolerating it well at all. If I'll ask if they have any question. If there's no question, seek their consent, which they've given. Then I'll proceed by taking their vital sign, making sure the patient is ready for the care, and then I'm going to ensure throughout the procedure patient is wearing the pulse oximeter so as to monitor the patient. And then if need be, this is the time I'm going to suction the patient, but at this point there's no need for suction. And then I'm going to raise the bed to a proper working level, raise the head of bed to semi-fowler, raise the patient's head to semi-fowler 30 degrees, and then I'm going to perform hand hygiene and wear my gloves. Then I'm going to remove the oxygen source and then take off the old dressing gently. Remove my gloves, discard, perform hand hygiene, remove the tracheostomy kit, remove away from me, take out the sterile gloves, take out the sterile mat. Make sure to place the mat with the shiny side facing down. Then I'm going to take the pack. I'm going to empty everything in the pack, place this down, go around my patient, pick up my 2 bottles, fill each section of the container with hydrogen peroxide and normal saline water of the bottle. And then I'm going to wear my gloves, my sterile gloves. Pinch. And scoop. At this point, I'm holding my hands above my waist level so as not to compromise the sterile fill. I'm going to then organize my kit. Place them in the already pre-filled container with the soaking solution. Okay, so the next thing I'm going to do now is to carefully take out the patient's inner cannula from the tracheostomy site, and then this I'm going to do gently, uncap it and lift and take out, pull out towards me, making sure the curvaceous side is facing down. Pull all around and place in the soaking solution. Leave to soak for a little bit. Take the inner cannula, take the brush, clean thoroughly, making sure there is no secretion on it. Once it's clean, ensure that it's the inner cannula is dry. Go around and gently replace, or more like return, the inner cannula into the tracheostoma with the curvature side facing down. Push that in, clip. Once that is done, I'm going to take the sterile applicator. I'm going to pick up the gauze. What I'm trying to do is to ensure I pick up the gauze. Make sure I dip it in the cleaning solution, and then I'm going to clean around the incision site, the stoma area. Make sure it's clean. Go round and make sure it's clean. Dispose, and then I'm going to take the Q-tip that is already soaked in the hydrogen peroxide. I'll still soak that in cleaning solution, in the sterile solution as well, and then I'll clean inside out, making sure I remove any crust or any secretion. Make sure I also touch the flange area, make sure it's cleaned. There. Once this is clean, I'm going to take one of the gauze. I'm going to fold gently and pat dry, making sure the inner cannula is still intact. After doing that, I will then have to remove the old tie and then replace it with a new tie. At this point, normally I'm supposed to have an assistant, but I don't have an assistant, but I'll make sure I secure the tracheostomy site so it doesn't pull off while I'm doing this. And then what I'm trying to do is to make sure they align such that it's not going to form any crisp on the patient's skin. And then I'm going to tie that. And then put my 2 fingers in just to make sure it's not too tight, such that it will be digging into the patient's skin. Then I'm going to now take the new sterile dressing, and then I'm going to place that back right over the stoma area. Then I'm going to take the 4x4 gauze, fold it neatly, and place that over the tie knot because like I mentioned, we're trying to maintain the skin integrity. So I'll make sure that is folded, and I'm going to tape it. And the taping is going to be not on the skin but over the 4x4 itself. And then at this point, the procedure is complete. I will gather all my used supplies, place them, ask the patient to see how they're doing, check my pulse oximeter to make sure it's within the normal range, and then at that point I can remove the pulse oximeter once I confirm the patient is fine. Find out how they're doing, ensure that my patient is comfortable. Once I've ensured patient comfort, I'll place the bed in a lower position, ensure the patient is comfortable. If they want the head of bed down, this is the point where I'm going to do it, but the patient said they are okay in the semi-Fowler position. And then I'm going to place the call bell close to the patient, and then I'm going to, like I mentioned, gather all my supplies, remove my gloves, my CERA gloves at this point in time, perform hand hygiene, and then leave the room to go document. Thank you.